step is to always practice good hand hygiene. Before feeding the patient or resident, knock before entering the person's room. Address the person by name, introduce yourself and title, explain the procedure before starting and during the procedure, and check the person's ID bracelet to make sure it is the right person. Then drape a napkin across the person's chest and underneath the chin. Tell the person what foods and fluids are on the tray, and prepare the food for eating. Serve foods in order the person prefers. Identify foods as you serve them, and alternate between liquid and solid foods. Make sure to allow enough time for chewing and swallowing, and check the person's mouth before offering more food or fluids. Make sure the person's mouth is empty between bites and swallows. Ask the person if they are ready for the next bite or drink. Talk to the person in a pleasant manner and engage in conversation. Encourage him or her to eat as much as possible and wipe the person's mouth with a napkin or hand wipe when needed. When the person is done eating, remove the napkin from their chest and discard, and remove all food and items used. Before leaving, ask them if there's anything more you can do for them. After feeding and before starting oral hygiene, practice good hand hygiene. Before starting, knock before entering the person's room and address the person by name. Introduce yourself by name and title, and explain the procedure before starting and during the procedure. Make sure to check the person's ID bracelet to make sure it's the right person. Put on gloves and place the towel across the person's chest, and adjust the bedside table so it is in reach. Hold the toothbrush over the kidney basin and pour water over the brush. Apply toothpaste to the brush. Brush the teeth and tongue gently and let the person rinse the mouth with water. Hold the kidney basin under the person's chin and repeat this step as needed. Break off an 18-inch piece of floss and hold the floss between the middle fingers of each hand. Stretch the floss with your thumbs and start at the upper back tooth on the right side. Work around to the left side. Move the floss gently up and down between the teeth and move up and down against the side of the tooth. Work from top of the crown to the gum line. Move to a new section of floss every second tooth. Floss the lower teeth in the same way, moving from the right side to the left side. Let the person use mouthwash or other solutions and wipe the person's mouth afterwards.